Well, Dr. Suhayl Essa worked at Charlotte Maxeke and has been seeing the added strain its loss has made to Gauteng's health system. We speak to him now. Dr. Suhayl, Dr. Essa, thank you so much for joining us. We understand that with psychiatric, emergency, several other cardiothoracic, etc., still closed, nearby hospitals such as Helen Joseph are dealing with the overflow and are just not coping with capacity.
Thank you for having me, Annika. Yes, so since the fire last year, we haven't been working at Johannesburg General. The emergency department's been closed for the last year. I've been placed or repositioned at Helen Joseph, Hillbrow Community Health Center, Edenvale Hospital, as well as Natalspruit. So basically all the neighboring hospitals around Joburg Gen that have had to take on the burden of the patient load, which is really putting a huge strain on these hospitals, particularly, as you've mentioned, the psychiatric patients, which we have seen quite a big spike in since lockdown and the COVID pandemic. As the cases reduce, we've seen a rise in the number of psychiatric patients that have been presenting to the emergency departments, which has become quite a massive issue. And the bed space is quite pressured at the moment.
Dr. Essa, I mean, one of the issues that a human rights group was saying that it's a little bit like Esidimeni because so many people who needed specific care have not been able to have it. And as a result, their health has either deteriorated rapidly or they've actually lost their lives because of the lack of beds and that particular hospital, Charlotte Maxeke, not being able to function at full capacity.
So I think the issue is in two parts. One, due to the lockdowns, a lot of psychiatric patients were not able to attend hospitals. So as it was already difficult for a lot of patients and their families to attend psychiatric facilities and get their medication. And then with the hospital being closed, Helen Joseph had to take on a lot of that strain, the fact that Charlotte Maxeke was closed, and it really is a dire situation. I mean, in the emergency department at Helen Joseph, you've got an overflow area, which is basically a container, a literal container that they use to transport goods, which is being used to house patients. They put beds in there, they've got nursing staff to take care of them. And that's only because of the vast amount of patients that presented and the overcrowding of patients. I mean, patients were literally sleeping on top of each other. They've had to take away more space for the medical patients, such as pneumonias and your run-of-the-mill medical problems. The psychiatric patients have now taken over a large majority of that area. It's quite dangerous, as I'm sure you know. Acute psychiatric patients can become a bit violent, can be a bit hostile and difficult to deal with. I mean, over this last year, we've had incidents. I was there one day when one of the security guards was actually stabbed by a psychiatric patient, and this could have all been avoided, I think, if we had another option to house these patients adequately. And I hope that it doesn't lead into another life Esidimeni type case.
Dr. Essa, we're also hearing that a lot of nursing staff and professional staff haven't had jobs because of the Charlotte Maxeke not reopening, and so they've moved on to other hospitals such as private, and so really good nursing staff and professionals have been lost to the state healthcare system.
So I think, look, there's a lot of anxiety that comes with being repositioned at different hospitals and not having a set schedule or a set team to work with. I mean, it was a bit jarring for myself and a lot of my colleagues having to be redeployed into many different hospitals and working in many different teams with new bosses and new people to interact with all the time. And I can understand on top of that, having to deal with the large patient load, the large amount of responsibilities, why the easier route would be to go into private. And I am aware of some of my nursing staff that I used to work with at Charlotte Maxeke, who've now moved on to private because it's just an easier option and more optimal for them in terms of their work environment.